Make time for leisure and exercise. Get them out for fresh air and sunshine and have fun, fun, fun.
Protect yourself from the novel coronavirus. Wash your hands thoroughly and frequently for at least 20 seconds each time. Avoid shaking hands and touching your face with unclean hands. If you have to cough or sneeze, do so into your flexed elbow or a paper towel and then dispose of it. Keep a distance of 3 feet away from anyone with the cold or flu-like symptoms. Boost your immune system with vitamins, drink plenty of water, and get adequate rest. Visit your doctor, the nearest hospital, or health center if you or a family member becomes ill. A message from the Ministry of Health and the National Emergency Management Agency, NEMA. If you own or work with animals, please follow these tips to avoid getting the coronavirus. Please keep pets away from areas where you are preparing food and eating your meals. Thoroughly wash your hands after handling animals and animal waste. Avoid contact with sick or stray animals. And always remember to wear protective gowns, gloves, and facial protection when handling them. As the novel coronavirus spreads, it is important that you continually disinfect your home. Viruses can gather on surfaces such as doorknobs, computer keyboards and mouse, cell phones, tablets, railings, kitchen and bathroom countertops, and remote control devices. To avoid transfer of viruses, wipe down these surfaces regularly with disinfectants such as Clorox, Lysol wipes, or soap and water. Avoid touching your face or your loved one's faces after touching any of these types of surfaces. It is very easy for viruses to be transferred in this way. When preparing food, be sure to use different knives and cutting boards for raw meat and cooked food. Wash your hands before and after handling raw meats. Also, wash your hands before and after using cooked food. Be sure to cook food thoroughly before eating it. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
So you understand what's going on?
Yeah, man, it's easy.
Okay, cool. Alright, then it looks like you know what's going on.
Older children may need less supervision, but they need your full support. A few tips for assisting children with online or home-based study. Check in regularly. Ask questions about what they are doing. Don't shout or get frustrated if they don't understand. Encourage them to take breaks from time to time. Be affectionate. Be positive. Sometimes a simple touch goes a long way. As much as possible, provide a comfortable space for children to work in. You may want to be more lenient with the desired study location for teens. Encourage them to focus by minimizing distractions such as television, music, or telephone. As much as possible, encourage them to separate their eating spaces from their study spaces, minimizing the risk of damaging devices.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the pace gone locked down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Whether you're at home or abroad, ZIZ's social media platforms help you stay connected with what's going on in St. Kitts and Nevis. Keep up with daily events by liking our Facebook page. Follow us on Twitter at ZBC Online. Like our pictures on Instagram and subscribe to our videos on YouTube. Also, you can watch us live on the ZIZ mobile app and our website, zizonline.com. No matter where you are, ZIZ is just a click away. ZIZ Broadcasting Corporation, reaching you wherever you are.
Currently, there are rumors and falsified reports circulating on social media about the novel coronavirus. For accurate information and updates, visit the Instagram and Facebook page of the Health Promotion Unit or the Ministry's YouTube channel at St. Kitts Health Promotion Unit or St. Kitts HPU. You may also visit online the World Health Organization or the Caribbean Public Health Agency. For further contact information, please contact the Ministry of Health for more info at 467-1172 or 467-1108. You can also be sure to follow the news to get the local COVID-19 updates. Let's all try to remain healthy and well. This is a message from the Ministry of Health and the National Emergency Management Agency, NEOC.
As fears about the effects of the coronavirus pandemic continue, it is natural that people may be experiencing more episodes of anxiety as a result. Common signs and symptoms of anxiety include feeling nervous, restless, and tense, having a sense of impending danger, panic, or doom, hyperventilating, sweating, or trembling, having trouble concentrating and excessive worry, having trouble sleeping. If you are experiencing any of these signs of anxiety, there are some things that you could do to cope. Reach out for help and talk to a trusted friend or individual who could help to distract you from some of the worrying thoughts. Avoid watching too many news items that focus on the negative impact of the coronavirus. Decide instead on a few specific times daily when you could get your news from reputable news sources. Make sure that you maintain some normalcy and regularity in your daily schedule as much as possible. Focus on the things in your life that you can control and do them. You can control what you watch on TV, what you listen to, who you talk to for support, and how you take care of your body. Remember to seek mental health and psychosocial support if necessary. This message was brought to you from the St. Kitts Mental Health Association.
The Ministry of Education and the Effective Schools Framework want you to be an effective parent during the home-based learning experience. To make this a reality, calm yourself before interacting with your child. Be positive and friendly. Tell children in advance how you expect them to behave. Don't use harsh consequences such as hitting and shouting. Instead, teach responsibility for actions and affirm positive behavior. Make a basic schedule which they can follow. Children like structure. Let children express themselves and respond positively. Make the learning experience visual and interactive. Remember that home-based learning should be at their own pace, no pressure. Make time for leisure and exercise. Get them out for fresh air and sunshine and have fun, fun, fun.
Good day and welcome to the National Emergency Operations Center COVID-19 briefing for the Friday, the 17th of July, 2020. Thank you very much for joining us today for this briefing as we continue to update you on what is happening with the COVID-19 pandemic here in the Federation of St. Kitts and Nevis and globally. I acknowledge the presence of the Minister of Health, the Honorable Keela Byron Nisbet, Dr. Cameron Wilkinson, our Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Hazel Laws, our Chief Medical Officer, and Mr. Abdias Samuel, Chair of the COVID-19 National Task Force. Without further ado, I would invite Superintendent Cromwell Henry, Divisional Commander for District A, to address us. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all. The Federation has been under a state of emergency for the past 3 to 4 months. Emergency regulations have been published to guide our behavior to prevent the spread of the coronavirus. These regulations were not intended to be punitive, nor were they intended to make life difficult for residents, but they do require a shift away from our normal way of life. A new normal, in a sense, is therefore required if we are to avoid becoming sick. The new normal requires us to maintain a physical distance of 3 to 6 feet from everyone around us when in public. It requires us to avoid social gatherings, social distancing. It requires us to wear masks when in public. It requires us to improve our hand hygiene and sanitization behavior. And it also requires us to close our businesses and be at our homes by specific times. A failure to adapt to this new normal could result in significant criminal penalties, including jail time. But as I said before, the main objective of the regulation is to save lives and to help keep us healthy, not to penalize us. So as we make the adjustments, we must understand that we cannot do things the way we are accustomed to. For example, we like to socialize on the beach, especially on weekends and public holidays. But Regulation 1611 has prescribed new guidelines as follows. A person may visit a public beach for the purpose of swimming or exercise. No more than 6 members of the immediate family should be in close proximity to each other. There shall be no picnics, beach parties, or other gatherings. And all persons shall adhere to social distancing and physical distancing protocols pursuant to these regulations. Last Sunday, July 12th, the police in Frigate Bay were kept busy enforcing this regulation on the beaches in Frigate Bay and the Southeast Peninsula, where several persons visited the beaches with their hi-fi equipment, tents, and food, with the intention of having beach picnics and birthday parties. We remind the public that such activities are restricted under the emergency regulations, and in any case require permission, written permission from the police. The regulation provides a person who contravenes or fails to comply with these regulations shall be liable on summary conviction to a fine not exceeding $5,000 or to a term of imprisonment not exceeding 6 months, or to both, and to forfeiture of any goods or money in respect of which the offense has been committed. As I mentioned earlier, we do not want to penalize persons or see persons be penalized. We prefer to get voluntary compliance. We therefore urge persons, residents, to take responsibility for their own health and safety and comply with the regulations voluntarily. Thank you.
Thank you, Superintendent. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center COVID-19 Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. So this afternoon, as per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for today, Friday, July the 17th, 2020. Now, the Ministry of Health and the Health Emergency Operating Center team, we've been monitoring the COVID-19 outbreak and pandemic over the past few months. And today in the New York Times, it was interesting to note that the United States have shattered its single-day record for new cases, and this took place yesterday, Thursday, with more than 75,600 cases. And this has happened some 11 times now, just over this month so far, the month of July. When you look at the total number of confirmed cases in the United States, based on the CNN tracking system, there are over 3,622,709 confirmed cases of COVID-19 in the United States at present. Now, in terms of deaths, Florida on Thursday broke its single-day death record for a second time with as many as 156 deaths due to COVID-19. And this trend is similar, is happening or occurring in other states, like 9 other states within the US. And when you look at the death toll for the United States so far, it's over 138, almost 139,000 deaths at present. And I just wanted to state here that more than half of the 50 states within the US have issued face mask requirements. And towards the end of my presentation, I'm going to speak a little bit more about face masks. Now, globally, what's happening? The pandemic continues to worsen, and in terms of, or based on information from the World Health Organization, as at today, this afternoon, there are almost 13,617,000 confirmed cases globally, and the death toll globally stands at 585,727. And you could see that in terms of the confirmed cases, the number doubled in just 1 month between June 16th to today, July 17th. Now, within the Caribbean region, what's happening? And so we are monitoring closely the gradual rise in the number of confirmed cases, which now stands at 75,739, and this is based on data up to July 15th. And the good news is there are a number of recoveries with almost 35,000 persons having been deemed recovered from COVID-19. The death toll, luckily, in the Caribbean so far, it's at about just a little under 2%. It's at present, the death toll is 1,485. So when you look at the total number of deaths and the confirmed cases, it's a little under 2%, and that's good, and I hope that trend continues. What's happening locally, as we are aware, we have we have had now 17 confirmed cases, 15 of whom have recovered, and so at present we have 2 active cases. Now we continue to test and test and test all our suspected cases and contacts of cases. So to date we've tested as many as 725 persons. What's happening in terms of our quarantine sites? So at present, as at this afternoon, we have 202 persons in government-designated quarantine sites, and our 2 active cases, they are in isolation also at a government facility. And to date, that is between February and the present, a total of 972, almost 1,000 persons would have been released from our quarantine sites. Let me just break down the numbers in quarantine a little further. As you are aware, nationals returning to the Federation, and at present we have 80 returning nationals, 50 in quarantine in St. Kitts, 30 in Nevis. And last week we would have shared with you that we have 124 students and 1 or 2 faculty members, a total of 124 persons in quarantine on the halls located at the Ross University School of Veterinary Medicine. So in total, we have 204 persons in government facilities. Again, this just highlights the total number of cases so far, and at present we only have 2 active cases in St. Kitts. All right, so we would have shared last week about the number of persons in quarantine at Ross, just to highlight that upon arrival in the Federation, it's almost 2 weeks now, all 124 persons, they were sampled and tested on arrival, and their first set of results were all negative. All right, the students are presently being monitored for the onset of COVID-19 symptoms, and so the health team at the Ross University School of Veterinary Medicine, they are monitoring the individuals on a daily basis. Now, on day number 14, all students will receive another molecular test, COVID-19 molecular test, and only those students with negative test results will be officially discharged from quarantine and allowed to integrate into society. And for today's COVID-19 Education Corner, it's very important for me to highlight just some of the benefits of wearing the face mask. And I hope I'll be convincing, by the end of my sharing this little bit of information. And so, again, in the New York Times today, there was some information coming out of a study conducted at Boston College, whereby they looked at some hairstylists and what happened to them recently. And there is a quote. They're just highlighting that this bit of information highlights the power of wearing the face mask or face coverings, especially in indoor settings. So there were 2 hairdressers at Great Clips, and they became ill. They contracted the COVID-19 infection, and they started exhibiting symptoms. However, it took a few days before they were tested and diagnosed. And regrettably, they continued working during the period of their being symptomatic or exhibiting symptoms before they were diagnosed. And they would have come into contact with as many as 139 clients with whom they would have, cut hair, permed, etc. And, after they were diagnosed and they took a history, all their clients, they were contact traced. And so the health officials contact traced as many as 139 persons. And the results were that they all turned up negative. And what's important is that the hairstylists, they were diligent in terms of wearing their face masks, and the clients themselves, they wore face masks. And so despite the interaction between the hairstylists who were infected and the clients, there wasn't any transmission of the virus from the infected hairstylist to the clients. And the one protection here was the face mask, and I'm sure appropriate hand hygiene also. And so it's very important to recognize the importance of wearing the face mask. because it's protecting you from the other person and the other person from you. And they provided us some additional information. Another study published in the American Journal of Infection Control just highlights that as human beings, we are constantly touching our face. And it's normal for us to touch our face as many as 23 times in 1 hour. And that's a mean. And so it's important also to try and keep your hands out of your face, nose, and mouth. And the study goes on to say that the coronavirus that causes COVID-19, it can remain present and infectious on the outer layer of your face mask for up to 7 days. And I'm sharing this information to underscore the need for us to manage our face masks properly. All right, so those of us who wear the disposable face masks, it's important for us to discard of them properly in the bin and always wash your hands after taking off the face mask. And then those of us who wear the cloth or the fabric, the locally produced face mask, I would recommend that you launder or wash these masks at the end of every day. All right, do not reuse a face mask 2 or 3 or 4 days in a row. So it's important for us to manage our face masks properly. So again, those of us wearing the disposable ones, remember to discard of them properly, after it's soiled, etc., and wash your hands thoroughly after you discard of the mask. And those of us who wear the locally produced fabric face mask, I would recommend that you launder or wash your mask at the end of every day. And again, once you've touched the outside of your mask, it's important for you to wash your hands thoroughly. Remember, hand hygiene is really the best defense against the COVID-19 virus. So washing your hands, soap and water, and the appropriate use of the hand sanitizer is very important. So remember, the face mask can protect you. It can reduce your risk of exposure to the virus. And so it's the face mask along with the physical distancing, remaining 3 to 6 feet away from, persons in your immediate, company, and trying to avoid social gatherings, mass gatherings. All right. One of my colleagues tells me that he was invited, or he has an invitation to a birthday party, and this right here in St. Kitts, and he's opted not to go because of being cognizant of the need of avoiding mass gatherings. And so we need to be responsible and adhere to these non-pharmaceutical measures that's going to reduce our risk of exposure to the virus. Thank you.
Thank you very much, Dr. Laws, for that briefing. It was interesting to hear you speak about the washing of the mask and the non-pharmaceutical masks, to have them washed every day. If we have to take a survey, I don't know who washes them every day, but it's good that that is what is the requirement. I now invite Mr. Abdia Samuel, Chair of the COVID-19 National Task Force, to address us. Mr. Samuel.
Good afternoon, everyone, and thank you for joining us again. And this, our National Emergency Operations Center briefing. And today we want to engage you again on a number of matters in which the task force has been engaged for the past week. I see Lesroy is smiling, so I mean he would have had a good week last week. Let's take a look at again, our theme. We want to be the first to be last and the last to be first. And I will keep emphasizing this as we go forward towards reopening our borders and also easing a number of the restrictions. The two presenters before me spoke about the wearing of masks, and this is one of the measures that we are looking forward for persons to keep being compliant to. We keep getting a lot of complaints of persons not being compliant, and the task force would have met, and some of the recommendations going forward in order for us to get some compliance is to, one, host a number of consultations, meetings with stakeholders, the general public, via various means. Two, we also look at the potential of making it a ticketable offense, whereby persons will basically have to pay a ticket. They will be ticketed for not wearing masks. We have seen how some curriculum leaders have echoed the sentiment of moving from having to take you to court and empowering the police officers to be able to give you a ticket. We look at the cost of these tickets. At present, if you are taken to court, you can pay anywhere up to $5,000 or 6 months in prison, or you can actually be fined both, which is the 6 months and still pay the $5,000. We are saying maybe we looked at some ranging of prices or costs of these ticketable offense, whereby if you don't pay, the ticket itself can become an automatic summons after 10 days. These are some of the recommendations that have come forward in our discussions as a task force. The reason for this is, again, for us to be able to have persons become compliant to these regulations, which are going to help us to remain safe against the impact of this virus. Again, the non-pharmaceutical measures are there. We are basically highlighting and emphasizing for persons to be able to continue to be compliant. We need your cooperation. Before we went into the lockdowns, we had a zeal, we had the connections with you, the general public, the business sector, social partners, and the support was such that everybody went into the lockdowns unified. However, the challenge is that we have to reopen in a very responsible manner, which is going to take time. And it seems that we have run out of patience. We have to be patient with the system. There are assessments that are being done in the best interest of the general public, and this is done just to safeguard you. So therefore, be patient with the system. The task force has been engaging in a number of meetings. We met with a nice presentation, I must say, was made to the cabinet last Monday. And the presentation, I think, the minister is here, so she might be able to say whether the presentation was impactful or not. But I think the engagement was very good with the cabinet, and I'm certain the cabinet will make the best decision going forward as it regards to the reopening of the borders. The task force also had the opportunity to meet with the chair and deputy chair of the Mitigation Council, where a number of measures were discussed in regards to, one, the repatriation process and the players within that process, such as the airline personnel, the persons themselves who are seeking to be repatriated, the health personnel, and other persons who are involved in the logistics of ensuring that this process is a seamless process, a safe process, and very secure. That was discussed, and we looked at a number of things that we can implement to ensure a more efficient and effective process. We were also able to meet with the Ross University School of Veterinary Medicine. And here we looked at the revising of the recent protocols that were put in place for the repatriation or bringing back the 7th semester students. And I think this discussion was very fruitful, and we look forward to the continued partnership as the Ross University will be bringing back a number of other students, such as the 6th semester, the 5th semester, and the 4th semester. I would like the general public to continue to support these measures as we are carrying out this balancing act of ensuring economic activities while ensuring that the public health emergency is not compromised in any way. We also had the privilege of meeting with the chairman, the new chairman of the Port Authority, that's Casper, and to bring him up to date with some of the activities that are occurring where the ports are involved. I think the chairman now has a better understanding of what the task force is doing and the collaboration that is required from our ports as critical facilities in St. Kitts and Nevis as we fight this pandemic. In an effort to bring back persons to work within the manufacturing sector, we visited the API Harrow Server in St. Kitts, which is located in Sandy Point, and we did an assessment whereby additional workers will be will be added to the already approved number of workers that are there at this moment. So effective at a date to be announced, they will increase their staff. We want to make sure that persons come out to work, but we want to make sure that that is done safely. And finally, one of the things that we do when we meet as a task force is that we evaluate the requests that are made and submissions that are also made to us for approvals. For example, one of the things that we have done is to ensure that tour operators or the sea tour operators such as catamarans and also those persons that go out to fishing and diving, sporting activities, they make a submission to us, the task force that is, and it's revised, and then necessary approval is given if they meet all the necessary criteria. So that is being done as we seek to stimulate economic activities in St. Kitts and Nevis. The repatriation process. I just want to correct something that I said on the last briefing. One of the things that we want to do as we seek to strengthen or fortify our system is to be able to encourage exit testing as part of our protocols. This is not yet in effect. This is a consideration, and what we try to do, as we have been doing for the past few months, is to sensitize you early of the intent of the task force in advising Cabinet as per measures that could strengthen the processes and procedures going forward to combat this pandemic. One of the challenges we are having right now is with the repatriation process. So in discussion with our IT personnel who is on the task force, we have decided that we are going to digitize this process and to make it more user-friendly and efficient. So we want you to have that great experience of not being overwhelmed by the process, but rather than the process to be friendlier and more efficient for you. And we're going to encourage you to visit the www.covid19.gov.kn website, and it will provide you more guidance going forward. Once we have this process digitized, we will bring it to you so that persons can understand exactly how to go about the repatriation to St. Kitts and Nevis as nationals. I want to acknowledge citizens and also organizations that continue and business places that continue to donate to the cause. We had 2 anonymous donors who contributed $1,000 each, and to them we say thank you on behalf of the task force, people and government of St. Kitts and Nevis. Also to the Home Economics Association, who would have contributed $5,000 to the cause, and to David Curry and Company Limited. Peter Curry would have had a discussion with Dr. Laws, CMO, and myself, and he expressed that he would like this donation to be used to strengthen our healthcare system. And to you, we say thank you as we continue to see the collaborative effort from our business sector, our social partners, in an effort to help the national response to this COVID-19 pandemic. I want to make a special appeal in my next slide to the general public for volunteers. We need volunteers. We need people to help us rebuild our country if we are affected or impacted by any type of disasters or hazards. And therefore, I am appealing to those individuals who are from the ages of 18 to 65 years old to show your patriotism and volunteer to be part of the NEMO District Volunteer Program. Also, it's important for you to be in good health, be available to travel. At this moment, you cannot travel, but you can actually travel within the federation. So we can move between St. Kitts and Nevis is one federation. And also, you can move up, we can move you from district to district until we are able to travel otherwise. And also, we want to make sure that you are available or you are someone who can adopt to training, because you will have to be trained. So again, if you want to do so, please call us at 466-5100 or visit the NEMO headquarters here at Limekiln Bastia. You will be given a form. You can fill out the form, and then you will be contacted. After being contacted, then we will carry you through an orientation process, and then you will be exposed for further training. Please make a valiant effort to be a volunteer. Contribute to nation building. Now let's take a look at the National Hurricane Preparedness tip for today. Let's look at technology and backing up and securing your data files is very important. So what we're asking you to do, if you keep a lot of files on paper, bearing in mind that one of the elements of any storm is water or rain. So therefore, keep scanned electronic copies of important documents. Even your passport is very important. Things like your birth certificate, death certificate, your marriage certificate, and so on. It's very important to have these things digitized. Back up your files on external devices, network file servers, hard drives, pen drives, or using Google Drive or OneDrive. And these are very important tips for the business places, offices, in particular government offices. And we are encouraging businesses to make this part of their protocols. Be sure as well to carefully label or note the content of the backup and test it to make sure the content can be read again. These are some of the recommendations that we are getting from our IT experts. And again, have a backup copy should be stored in an alternate secure location in the event your office or storage location sustained extensive damage. And if you use a laptop, be prepared to take your laptop home or to a shelter with you if necessary. Bearing in mind too, you have to secure it, because if you take it to a shelter and you leave it there, someone could have more interest in your laptop than you, so secure it properly. It's very important. So those are your tips for today as we continue to prepare for the 2020 Atlantic hurricane season. Thank you very much, and we will now await your questions.
Thank you very much, Mr. Samuel. We are now at the question and answer segment. One of the very first questions, or the first question is, how confident are we that all contacts were traced for the frontline worker recently infected with COVID-19? Dr. Laws.
So we are thankful for that question. It's a very important question. And what I want to say is that the frontline worker who interacted or had contact with the case had minimal contact, a very low-risk contact with the case. And so the public health team is quite confident that we would have contact traced all the contacts. They have had their initial test. They are in quarantine, awaiting their 14-day, their second COVID test on day 14. The public health team continues to be very comprehensive and robust in its approach to contact tracing. Thank you.
Thank you, Dr. Laws. This next question pertains to how frontline workers can be better protected. Because the case, the last case, was a frontline worker. So what can be done to ensure that this does not happen again? Dr. Wilkinson.
I think this will be the third time that I'm addressing that question. Now, one of the things I said previously was that in protecting oneself, one has to don or put on the personal protective equipment, and you have to take it off. And in most institutions here and around the rest of the world, when healthcare workers become infected, is usually some break in the process when they're removing the equipment. And I say sometimes it can come over time through a bit of complacency, etc. I'm not saying that that was the case in our particular case, but one of the things that we're going to do to make sure that we strengthen our system is to make sure that we have continued retraining of our healthcare professionals in the donning and the doffing, and we make sure that even if it is someone who you don't think had any significant exposure, you would still carry out the same protocols, because truth and in fact, you don't know who can be asymptomatic or pre-symptomatic, so you have to have the same level of vigilance when you are dealing with these cases. And in reference to the first question, because I suspected the underlying current in that question was whether or not we thought other healthcare workers became exposed. And what you have to understand that that healthcare worker was also in a situation with other healthcare workers who were properly attired in their PPEs. And so the risk of transmission in that scenario was significantly decreased, and the number of persons who were tested within that circle, and we are pretty certain that everything is going to be fine.
That brings us to the end of our questions for today. There was something else, but it's not a question, it's a concern, and it's an ongoing concern having to do with people not wearing the mask on the buses. That is, it's not a question, but I think it has been addressed over and over again. And so people are asking if there can be more vigilance in terms of the police being more vigilant and making sure that people are wearing the mask. Dr. Wilkinson would like to say something.
I just wanted to say, because Mr. Abdia Samuel just shared something with me from Barbados, where they're rolling back some of the protocols that they had put in place. And that's one of the reasons why I'm happy that we can sit back and look and see what's happening in other Caribbean countries before we rush out of the gates. Because one of the things in their protocols, which I mentioned on Tuesday, was that persons who were going to Barbados in the so-called safe bubble, low-risk areas, they did not require a COVID test prior to entering Barbados. And one of the things we said that in our protocols, we might suggest that everyone coming here have a negative PCR test. And Barbados has just changed their protocol, indicating that even if you're coming from the safe bubble, you should have your PCR test. And persons would be required to be quarantined for at least 7 days and have a second test before they're released. So we can't follow the crowd. We have to do exactly what is right for us. Thank you.
Thank you very much for your questions for today. We hope that the questions were adequately answered. And if they were not, of course, in this forum, you can always ask a follow-up question. I want to thank Superintendent Cromwell Henry, Divisional Commander for District A, for his sharing today. Our Chief Medical Officer, Dr. Hazel Laws, who continues to provide us with the most up-to-date and relevant information with respect to the pandemic. Mr. Abdia Samuel, Chair of the COVID-19 National Task Force, and of course he's also the National Disaster Coordinator, so we have him as well giving hurricane tips and so on. We thank the Honorable Akila Byron Nisbet for being here to offer, of course, her support to the National Emergency Operations Center. We thank Mrs. Christmas Jacobs for her dedication in terms of providing at all these briefings the service of sign language. We continue to thank the media for partnering with us to bring information to the public. Of course, we don't want panic and we don't want paranoia. What we want is that we want official information and relevant information that you get here at these briefings. So thank you very much for all of you who have tuned in today to the National Emergency Operations Center COVID-19 briefing. Next week, Wednesday, we will be back. I hope it's Wednesday because for the past 2 times, we've had it on Friday. On Wednesday, of course, there was the Black Rocks event, the commissioning of the decks and the boats and so on. It's a pretty lovely thing that has been done down in Black Rocks. Of course, you know, we are bringing tourism to the rural areas. It's a historic site, the Black Rocks site. So thank you very much, and we look forward to seeing you next week, Wednesday at 5 p.m. Take care.